Many shades of pink and black health. Many shades of pink and black health, where good health equals long life. Welcome to the Many Shades of Pink and Black Health radio program on KBOKradio.com. I am your host, Wendy Sherrill, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Flalo, a retired family physician. And our special guest today is Dr. Kelly O, MD, board-certified OBGYN. So, Kelly, welcome.
Thank you.
Our topic today is a champion to women in health and wellness. So we appreciate you being here today to share your story with us.
Thank you so much. Thank you both for inviting me.
Yes, we are so happy to have you, and we indeed know that you are truly a champion to women.
That is my goal.
So why don't you do this? Tell us a little bit about who you are, yourself, and about your family, first of all.
So I am a board-certified OBGYN, so that means that I have gone to undergrad, Xavier University of New Orleans, completed medical school, University of Chicago, and then did my residency here in San Diego. Took my boards and passed them, thank you, Jesus. And I've been practicing obstetrics and gynecology for the last 16 years.
Okay, so what about, just to dive a little bit more into your personal thing, do you have siblings, and are you married, kids, that sort of thing, just more your personal you?
So I am first of all, a woman. I am a physician, as you already know. I am a wife. I am a mother. I am a daughter, sister, cousin, best friend. So I have 3 siblings. Actually, I have 2 living siblings now. Okay. Both of my sisters, they live in St. Louis. My mother, she lives between here and St. Louis with us. And then I have a husband and my son, Mr. Francis.
And he's how old?
He is 4 going on 5. He is my love baby, my love on top.
Yes. Her little pride and joy. You're a little cute little thing, too.
Yes, he is.
So that's awesome. That's awesome. So did you actually, where were you born and when, because you've named a lot of places where you went to school, but where were you born and where were you raised?
Yeah.
So I'm a shy Cali girl. I am originally from the west side of Chicago. I came to Southern California, Los Angeles area when I was young. Did a little bit of elementary school there, moved back to Chicago, suburbs, did a little bit of elementary school and middle school there, and then came back to San Diego, Mira Mesa for high school, and then been traveling ever since, and now I'm back home in San Diego.
So you're kind of like a Midwest Cali girl.
I'm shy Cali.
Right, okay. I'm like that because I was raised in Ohio, but I've been out here for like almost 30 years. So I call myself, I'm a Midwest Cali girl. I'm a San Diego native now, but that's how. Yeah.
You bounced around quite a bit.
I did. So when people ask me like, who are your real sisters and brothers, family and friends are very much intermingled. Just because when we came out to California, we didn't have any blood family, but I had my godparents, I had my god cousins, and then our friends that just have always taken care of us. So that's pretty much how we live our lives. Family and friends are very interchangeable.
Absolutely.
Yeah, that's true. I don't hardly have any family, but sis, she my family.
She
my
adopted me.
sister. She's my sister now. I'm a sister that I never had.
Absolutely. So I'm curious, as a physician, what made you decide to become a physician, and why did you choose OBGYN?
So I feel like being a physician has been my calling. Kind of like I say it all the time, as a pastor or a minister is called to the pulpit, it's the same thing for me. I didn't grow up around physicians, so I didn't even know, but I was just told when I was 4 years old, you're going to be a doctor by a higher power than myself.
Wow.
And from there, doctor, I'm going to be a doctor, police officer, a lawyer, all of that at the same time, right? And then from there, I just have been surrounded by women that have had difficult times in their lives. And unfortunately, I've been around women that have been through a lot of domestic abuse, sexual assault, and rape. And I felt like being an OBGYN was my way of giving them a voice, making sure that they're healthy and well taken care of so that they can go out into the world and do great things for themselves and their families.
Absolutely.
So question, who had the most influence, like who had the most impact on your life?
So Margaret Elmore, my mother.
Okay, great.
And my grandmother Ora Marie Cunning, and my other grandmother Mary Jones. So those were the initial 3 women that basically molded me, who I looked up to, and just whatever I said I wanted to do, they just made sure that I was able to do it.
Right, you're a great support system.
Exactly. And then my dad died when I was young, so I had wonderful black male role models that came and stepped in, and acted as the father figure that I needed, so that I knew that I would be a positive young black woman in this world.
That's awesome.
That's awesome.
And you can't replace anything with having a strong female role model.
Yes.
So you had 3. You were blessed with 3,
yeah.
which is awesome. I'm curious about who would you say was your best mentor in your educational journey, especially through the medical profession?
So I, don't want to leave anybody out, but to be honest, it started a little bit before that. Mrs. Barnhill, who was my vice principal at Mira Mesa High School, she allowed me to start the Black Student Union, and we did that thing, and it was beautiful. Also, Rosemarie Duke, she was a Delta, and she's also an educator here in San Diego. She helped my mom and I figure out how to get scholarships and apply for being an AKA debutante, and get all these scholarships that allowed me to go to school. And then when we talk about just in college, going to Xavier University of New Orleans is the best experience anybody that could ever want to be a doctor, and is specifically a person of color. You can't get a better experience. If you want to be a doctor, you go to Xavier, you hop on the Xavier train, you get off at MD. So at least they're going to get you in there and through. It's your choice to finish, but they're going to get you in that door. And then I have to say the biggest influence for me was Dr. William McDade, as well as Dr. Nikki Moo Young. Those were physicians at the University of Chicago and in Chicago that literally took me under their wing and made sure, by being good role models, but also by actually physically helping me. Sitting down and saying, Dr. McDade, I don't understand this. Okay, this is how we do that formula, blah, blah, blah. And then Dr. Moo Young, she was already an OBGYN. And I was just like, wow, this beautiful African-American, intelligent woman, I want to be that. I want to be like that. Dr. Anita Blanchard, I had the Cook County Medical Association. A lot of people from there at my fingertips. And we had a tight-knit group of people in school, both African American and non-African American, who just worked together to make sure that we, were successful.
Well, I have to say that my journey was a little different. And that's why I asked, because I went to George Washington Medical School, which is mostly white and Jewish. There were probably, I think, out of our 150 student class, there were maybe 5 blacks in the class, and I think 3 of us graduated, and it was not a supportive. I think there was 1 African American professor there, microbiology. So I didn't see anyone that looked like me, so I felt like a fish out of water. Outside of being nurtured by Xavier and all of your classmates, a lot of them looking like you, at least a higher percentage of them. And it was very cutthroat there. I mean, people didn't want to share their notes, they didn't want to study together, so it was a rough road to travel. But I would have preferred to go on your road, which would have made life easier.
That when you do go, you decide to go to, a historical black college, especially coming from San Diego or the West Coast, because they do not have, any black colleges at all. And that was one of the reasons why I chose to send my daughter to a historical black college, because I felt like in life you really need that you need diversity. And by her going to all white school, high school, from elementary, middle, to high, I felt like in the world today, in the climate that we have, we actually have to have them to be diverse. And when you go, I can't even tell you that those schools, I'm gonna tell you, that's a special experience, because I tell you, when you go to one of those type of schools, it's nothing like it. They make sure you succeed. You're not a number. You know, you're somebody, and they're going to call you by that name, and they're going to make sure they just prepare you for so much.
That's good.
As long as you engage engage in it, you will be prepared. But back to your point about going to George Washington, University of Chicago is quite interesting. It is in the middle of quote unquote the hood.
Yes,
a lot of people don't know that, and it is an Ivy League school in the Midwest. The reason why we had such a great experience, I had such a great experience, is because, like I said, those black physicians that were there, they made sure that we knew who they were before we started school.
Oh, fabulous.
We also had a absolutely fabulous Dean Norma Wagner, Caucasian woman, but was clear that everybody that walked into that school, no matter where they came from, we are here to make excellent physicians.
Wow.
It's not one of those things where you walk in and they say, look to your left and to the right, one of these people will not be here with you when you graduate. It was, we admitted you to this school and we expect and we are going to make sure that you graduate from our school.
Yeah.
So, and even if you didn't graduate with an MD, you may have switched over to a PhD or MBA, but they wanted you to be successful.
Absolutely.
So,
That's so awesome.
And where it's located, the way it's situated, you would just... It's crazy. I had a business downtown Chicago.
Okay.
And so when they telling me this is I'm like, and then I'm like, how does it feel like, even with the white students being, you know, because that's what you see on the outside, but it didn't bother them. I mean, you know, it was a very unique situation how it's set up.
Wow.
And you know, it makes a huge difference when the president of the United States at that time, senator,
yes,
right?
yeah,
and his wonderful wife, are around the corner,
right?
And I didn't know that. I think I went to a book signing when I was there. But one of my friends, Dr. Marsha BF, she was actually involved in kind of the Black Student Pre-Med program, where they did have Miss Michelle Obama come there while she was there at school.
Wow.
So, you know, when you are like 1 degree of separation to these people that we're sitting here right now admiring, you feel that.
Absolutely.
Yeah.
You may not know what you're in the midst of at the time, but when you realize it, you're like,
wow.
Okay, I can
what
do
an
this.
experience, right?
Yes.
That is so awesome. So, I know you have military background, so I'm curious as to, when did you decide to go into the military, and why?
So all the men, like I talk about, in my family, my brothers, my god brothers, because they're not my blood brothers. 2 of them were active duty Navy. My stepfather ended up doing 28 years in the Navy, retired from there, went into government service with the Navy. When we moved here from Chicago, we lived in Mira Mesa, which at that time was Navy town.
Military city.
That's how I started getting introduced to the concept of the military. And then I actually happened to be at Xavier University, and I'm a member of Delta Sigma Theta Sorority Incorporated. One of my line sisters said that she was going to med school and the military was going to pay for it, and I said, and I had honestly just been on a plane with, back in the day on Southwest, when you had the seats facing each other, the business seats facing each other, and I remember 2 businessmen asking me, you want to go to med school, how are you going to pay for that? And I was like, I'm not really sure. And they said, you should try the military and they can pay for it. Right. What's that? When I got back to school, I talked to my line sister and I said, this does exist. So yes, Kelly Elmore called up the recruiting, and from there on, they paid for school.
Right.
So did you sign up immediately after graduating from Xavier?
So you can start your application process, but when you get an acceptance letter, that's when you start the whole, they're willing to interview you for acceptance into that program.
And once you get into the program, if you're graduating from college or university, do you go in as not an enlist, but actually as an officer, right? So explain that a little bit to the folks on the audience.
Yeah, to the audience.
So basically, because I had a degree and I was heading into medical school with an acceptance letter, then you get offered officer admission at that point. When you go into the recruiting and you may not have a degree, or you don't have a degree that's highly sought after in the military, then you go in as enlisted. But when you have an advanced degree, most people with advanced degrees are going to go in as officers.
Yeah.
That's awesome. Well, I think what we'll do is we're going to take a small break.
Okay.
I want to get back into it, but I'm glad that we could explain to the audience the benefits of going into the military, especially when it's going to pay for your higher education.
Yes.
And so
they can be enlisted as an officer.
absolutely.
As an option.
I thought about that, but I'll tell you why I didn't do it afterwards. So I think what we'll do is take a small break right now, and we'll be right back in just a couple of minutes.
I'm a breast cancer survivor.
We are honoring our heroes.
I'm here today because of Susan G. Coleman's free mammogram.
We are pledging to save lives.
We're passionate about bringing the services out to the community.
We are providing free mammograms. We are providing hope.
We are more than pink.
Made possible by Anderson Plumbing, Heating.
All right, we didn't have that, a little short break. Welcome back to the Many Shades of Pink and Black Health Radio program.
And our special guest today, of course, is Dr. Kelly O, MD, board certified OBGYN. And our topic, in case you've forgotten, is a champion to women in health and wellness. So when we finished right before the break, we spoke a little bit about making sure that people knew why it's a benefit to actually join the military and be able to almost get what we would call a free ride. I know you pay it back in years of service, but it's great to come out and not have a $300,000 debt.
Right.
So that was good. And so you've done how many years of service so far?
So I'm 16 years of active duty service and 4 years of reserve. But 16 years active duty service.
So 16 years straight. Is there any interruptions or
No?
All right.
So
that's awesome.
can't you retire at 20 years of service?
Yes, I can.
So what does the 4 years of reserve count towards that?
So the 4 years of reserve was the time I did while I was in medical school. So when you're on your summer break in medical school, or you're doing like a sub internship where you go to another hospital and work as a medical student, then that counts as your reserve time.
Okay.
Once you hit 20 in this program, then if I retire at 20, that 4 years gets counted on as 24 years of service.
Okay.
But you have to hit 20 before that 4 years
Okay.
gets counted. Yes.
And so I'm just curious about your future choice. Are you planning on stopping at 20?
So at this point in my life, I am gun ho for doing whatever I can possibly do to continue to advance forward.
Okay.
Now,
Okay.
if that means that I get to advance forward in the military, I advance forward in the military.
Okay, yeah.
If that means that the Lord sees me to veer off and go community or civilian private, then that's where I'm going. But I'm all in on making sure that I am the best at what I do.
Absolutely.
So whatever comes up, I can make that choice.
And you still have the opportunity, even if you do retire, that you can go back as a consultant? Is that
So you can be a reservist after you get out. You can go in as a government service worker like my father did.
Okay.
So those are the two options.
Okay.
And yes, if you had your own private consulting company, you can contract and bid contracts for the military
Okay. All right.
or
So,
DOD.
question, why did you decide to obtain your MBA?
So that's something I always knew I wanted to do. I didn't realize how much of an entrepreneur I was until I met my best friend in Chicago and her mother. So Erica Jordan and Cynthia Jordan are amazing women, female entrepreneurs in Chicago. And I just love the fact that they were able to create their future. And so I decided, okay, I wanted to get my MBA while I was at University of Chicago because I figured, well, I'm already doing my MD, let's do the MBA, but I didn't realize I could do that at the time. So I waited, I graduated, became board certified, worked as a staff for 6 years or 3 or 4 years, and then when the opportunity came up for the military to send me for an MBA, I took that too. So I worked full time and went and got my MBA.
Okay.
That's
The
impressive.
importance of that is physicians are not taught how to run businesses, and a lot of physicians have been in private practice,
Yes.
and those private practices have not been as successful as they could be because they are not business minded. Also, your degree does more for you than see just patients. So at this point, this has allowed me to become a director in my hospital. It's allowed me to move forward on that executive track, and it's also helped me manage our clinic of patients better so that we can get the patients the type of access that they need and the time they need with their physicians. and do it for a plethora of people.
Absolutely.
Yeah.
So, do you see yourself as a visionary or CEO, MD?
I absolutely see myself as a visionary. I absolutely see myself as a CEO. And the question of that, is a CEO of your own company, a CEO of somebody else's company? Either one.
Okay.
That's something that I know that I can do. I have the right people in front of me to help me get to that point, and the right people around me to support me through it.
So then, before we even get into what a typical day looks like for you in your practice, I'm curious because you mentioned something about being a CEO. So tell us about this KOE, Medical Consulting Incorporated business.
So, as I said, because I am employed and an active duty full-time officer, everything that I do outside of that has to be associated with not the military.
Absolutely.
Okay.
So essentially, one of the things that the military does allow you to do is to get experiences in other places outside the military, so you can bring those experiences back to your job at the military.
Okay.
So it really was created because I had to have an organization or a business that didn't just say Kelly Elmore. So that's where it got started.
Okay.
Okay.
And then also, it provides more credence when you have your own company behind you.
Absolutely. Absolutely.
It's brilliant.
So I minimize, my day job, my number one job is always number one.
Right.
And this allows me to sit here with you as Dr. Kelly OMD, right, who works for KOE Medical Consulting.
Right.
And it allows me to go out to the community and volunteer under my own name and own insurance
Absolutely.
and everything like that. So it separates the organizations.
Okay. And when did you actually create the
2010.
2010.
2010,
Okay.
yeah.
Fabulous.
And so outside of the KOE, what is this Viva Life?
Viva Life.
Viva Life. Yeah.
Viva Life. Well, like you said, am I a visionary? Yes, I am.
Right.
I am somebody that wants to take life by the horns and live it to the fullest. So Viva means live, and life means life.
Yeah.
So what the whole point of Viva Life Health Hub is actually a program under the nonprofit called Logan Heights CDC. And essentially what we're trying to do is build that concierge experience in the community. The reason why is because a lot of people in our community may not trust.
Yes.
They find the doctor that they like and they stick to it, and they pray that doctor don't ever retire.
Like this one here?
Like inside.
Right. But I don't think people understand that we as physicians, providers, really provide concierge care to our patients.
Yes.
We don't leave our patients at work.
Right.
We take them home with us.
Yes,
right.
we do.
And even though we know we should self-care and be off work and all that other stuff, my patients know that they can contact Dr. Elmore 24/7. And if I'm not asleep, I'm probably going to answer to you.
Yes.
And it's that type of thing that we're trying to instill in our patients. It's time for you to find a physician that you can trust, or a provider that you can trust, that's not too busy for you. And this is global.
Exactly.
So my network extends to what you have access to. So, for example, one of my line sisters, she is a dynamite transplant surgeon in Dallas.
Wow.
Why is there any reason that we can't get you on a plane if you need a transplant surgery and get you the best surgeon that I know that
Right.
looks like you
Exactly.
and that's going to provide excellent service?
Right.
Right.
Why can't we get you to DC? Why, if you're in Japan, you can't get to California?
That's true.
So that's the whole idea behind that concierge Viva Life. And then the other thing is mentorship. Somebody has to replace us.
Absolutely.
That's true.
I'm trying to find one, doctor.
I know, huh?
So the mentorship piece is very important. So my mentorship started with just going to the high schools. I had a teacher from Lincoln High School that said, Dr. Elmore, will you come talk to my AVID class? Well, I'm a graduate of AVID. If it wasn't for AVID, I probably would not have passed geometry because my thought pattern was just different.
Right.
So when she asked me, will you come to the AVID class and help me with my kids? Absolutely. I have a couple of mentees that want to be military OBGYN at Xavier right now.
That's fabulous.
And that's what that mentorship is for. But it can't be me alone.
No.
So I get you. That's what the Viva Life Health Hub is about.
Right.
Oh, now you know me. You know Dr. Flalo. You know Dr. McDade. You know Dr. Gooden. Let's get you where you need to be.
All the resources.
All the resources.
That's fabulous.
Yes.
That's
And
really
then lastly, Viva Life is about connecting that community together. So you have fitness gurus, right? So you had McKenna on here 2 weeks ago.
Yeah.
Garganu. Her husband, Nasara, is a fitness instructor. Alicia, Sharice, she's a fitness instructor that owns her own business. Both veterans of the United States military.
Absolutely.
Both are my fitness instructors.
Right.
Okay.
Right? So they keep me in shape.
Okay.
So now we have this hub where it says, "Oh, you go to Nasara's class. You're a female that needs help. Oh, well, Dr. Elmore, we know does that,
Right.
and it's something that everybody is involved in.
Absolutely.
You know,
It's
what I'm
a
saying?
network.
So it's a network because your network, as Jay-Z said and Beyonce, is your network.
Exactly.
Absolutely.
So if your network is this big, that's probably where your net worth is going to be.
Right.
No, that's so awesome.
Yeah, no, that is awesome.
And such a benefit for the community.
Yes.
And for everyone that you touch, the lives that are touched, we can not only help them in so many ways, spiritually, physically, health-wise, everything, so that we have a full and healthy being.
And we need that. I mean, our African American community and just communities in general, we need that type of leadership because we need so much.
Right.
And if we have leadership like you guys in the community, physicians like you guys, then I can't even imagine what our future is going to look like, if we keep on doing what we're doing. And I have to say that there's just truly not enough black physicians that have passion. You know what I'm saying? And just physicians in period, like UCSD, I love all the physicians there, but a lot of them, I really haven't met too many physicians that will go out in the community and, just...
Right. And that's why that's really where the hub comes from, is because I saw that. I saw that my colleagues, they are working hard.
Right.
Right. We talk about physician burnout, provider burnout all the time. But are you getting out into the community where your patients need you?
Right.
And a lot of times it's like, they put doctors on this pedestal, and it's not necessarily because we're definitely not better than anybody. Everybody's human.
Exactly.
Right? But we're so far away that it looks like you're up here because you're not attainable, right? So when I tell you, can you please consider taking this high blood pressure medication or changing your lifestyle, you're like, I'm not attainable, right? This is coming from somebody that does not look like me or does not act like me, doesn't have the same struggles. Well, let me let you know.
Right.
I have the same struggles. Okay? So that's why the hub came along, because I wanted to take my friends and fellow veterans and say, let's get out here in the community.
Right.
And one of the other nonprofits we work with a lot besides you guys is the Mission Continues, which is about bringing veterans into communities to do volunteer work.
Fabulous.
And that's fabulous because we really need some volunteers, really. We do.
And they're probably all over.
everywhere.
It's just
Yes.
getting them connected, because
Connected.
I'm sure people are doing good things out there. We just don't know about it. So
Right.
we're over here struggling, trying to do something ourselves. And if we just can get connected with people that are doing things, have the same purpose and goal and passion, and put us together, we can just be also more powerful.
Right, just connecting the dots.
Right.
You know, so just to make what we're doing, and like, is it Veterans Unite? Is that something that you do? Because someone also told me about,
Veterans
Veterans
Unite.
Unite. Yeah. So I'm all for helping the veterans. They have so many different programs that is being created, and me personally, I would want to use the veterans for volunteers.
And this is what they know. They know missions.
Yes.
So if you present a mission to them that is consistent with their ideals,
Then
they're all in.
Yeah.
So that's exactly what trying to do.
Yeah.
Collaborate together so that we can achieve the mission.
That's fabulous.
Okay, I would
well,
like
now
to-
I'm just curious. I'm sure the audience is curious as to what does a typical day in an OBGYN's life look like in the clinic and surgeries. Tell us about that.
And then being a
For a
mother.
typical OBGYN,
Forget the mother. I'm talking about her.
so a typical OBGYN, this is what's so wonderful about being an obstetrician gynecologist. We do both. I always tell people we deliver babies and we take care of the breast and the uterus, ovaries, and tubes. Everything from your navel down to your thigh.
Right.
So a typical day for me, because in a teaching hospital, you come in, you round on the patients, and that rounding can be with or without residents. Then, 20 minutes later, you start either your surgical day, and your surgical day could be all day or it could be a couple of cases. Or if you're on labor and delivery, you could literally be backing up or primary, delivering vaginal deliveries, doing C-sections. Somebody can come in through the ER and they need a surgery right away, so then you're going in doing surgery on somebody like that. Or you can be in clinic where you have a clinic day and you see patients every 20 minutes, or 40 minutes, however your day is set up. So our days are in flux all the time. And it's wonderful. And then at night, so if you take call, you could be a OBGYN that takes call in-house. So essentially somebody calls you from the hospital and says, we need your help delivering a baby, either a vacuum, forceps, or a cesarean section. Or you could literally have to be in the hospital backing up somebody, or you be the primary, watching the baby's fetal heart rate to make sure that detrimental things are not happening.
Absolutely.
Question, how do you manage to balance your personal life, how do you be a mother, a wife, and balance your career? How do you do that?
Some days I do it great. I'm rolling. This is a good day. Some days not so well. I think and I talked about people like their plate, like their food plate. It's portion control. Right?
Yeah.
So I know from 5 a.m. in the morning until most of the times 6 p.m. at night that this is my OBGYN job, right? I get up, my workout is a part of my day, is a part of my job, right? My meditation is a part of my job. And then I do my whole patient care thing. And then at 6 o'clock, I'm driving back in, and then I'm talking to my husband on the phone. I call my mama, my husband, whatever else I can get done.
Okay.
And then, I get home and cell phones and everything go away. Then that's dinner time.
Okay.
And, most of the times it's either my mom or my husband that have cooked, or we figure out something when I get in there. And then dinner time, bath time, reading time, bedtime. And, then you start all over the next day. And in between all of that is, okay, Dr. Flalo, Wendy, where's your next? I can fit that into my calendar. Okay. Oh, you need some mentorship? Okay, I got 10 minutes on the way to work. What you got? So, and then you take vacation.
Yeah.
Right.
So a vacation for me is typically a little work involved, but for the most part, it's vacation.
That's good. That's good. So I'm curious, just on some of the surgeries, because I know I've been there, done that with some of the surgeries, scary ones nonetheless. When you think it's a typical vaginal delivery and you end up having to do a C-section because of either a complication, maybe a shoulder dystocia, or who knows, or decel, desaturation, or anything with the fetus at that time, or the infant.
Right.
So what would be some of the most challenging cases in your, not so much the GYN piece, but the OB piece of it?
I was just having this conversation today. It's easy when the baby's heart rate looks good. It's actually easy when the baby's heart rate looks bad, because you gotta do something. It's that time in between, and most babies have time in between.
Well, you're not quite sure if they really call for a surgery, or you kind of waiting it out.
So that's where you depend on your team, your nurses, your midwives, family medicine practitioners to say, I'm not feeling comfortable with this. Can you come down? We are a team. Whatever we do, we're a team. And if somebody doesn't feel comfortable with your decision-making process and they think the baby's being compromised, then you go to the next person that will listen. And then you all get together and say, you know what, this could be absolutely what you're saying. This baby could be compromised, or the baby could not. But the only way I'm going to know is when I get the baby out.
Right.
And sometimes, yes, we do cesarean sections where people will say preemptively you didn't have to do it. But when you sitting there, at the goal line, you got 2 seconds left on the clock, and you can either kick a field goal or you can try for a 2-point conversion.
Yeah.
But all you need is 1 point.
Yeah, exactly.
I'm kicking the field goal.
Yeah, absolutely.
Right.
No,
Right.
and you don't want to, and at this point, you're talking about 2 lives in your hand.
Exactly.
You know?
Exactly.
And the rest of the family, because something happened to that baby. It's
Baby.
not just the mama; it's the daddy and the sister and the uncle and the cousins and everything. like that.
Everybody. The
And if you
whole
don't make the right
family.
decision, I mean, I've seen several young women. We always think about our high risk patients, but I've seen a couple young 27-year-olds that lose their life on the table, and we have to do a cesarean because they had like preeclampsia or
Oh, yes.
eclampsia,
Yes.
you know, and everything that we gave them didn't work, and they end up dying. They're dying, and we have to hurry up and do a C-section
Right.
to then save the baby.
Yes.
So the poor husband, you know, new husband of a year or two, just lost his wife, but was able to save it. I mean, those are people don't realize they take childbirth for granted, but they
Oh,
don't
yes.
realize how risky it every single
They really
time
do.
we're trying to either deliver a normal, what seems like
Right.
a normal pregnancy and a normal delivery. That's not always normal.
Well, I
you know.
I was a high risk, pregnancy. I almost died with my daughter, and it was such a trying experience for me, where it jilted me to where I didn't even want to, have another kid, and people just think that, oh, you're pregnant, you're going to have a baby, and it's just easy, but it's so much involved. I end up having pregnancy diabetes, preeclampsia, all this stuff, that I never even heard of,
Absolutely.
so there is so much in detail when it comes to pregnancy, and especially with Black women.
Right. And speaking of that,
Yes.
hopping over to that, because
Yeah.
I mean, and that's with following with good prenatal care
Exactly.
visits. But we'll get some young women that don't necessarily have prenatal care, their first visit or follow up, and then we have young people, or even sometimes older people that come in that really haven't been followed well. They end up having complications, but also the fact that we end up having low birth weight infants. So tell us a little bit about Black Infants Health.
Yes. So that is another organization that I
Absolutely.
try to volunteer my time with. I'm always promoting it. So Black Infant Health is about more of a kind of centering with the women, right? So basically you're trying to bring women in together in a group setting to talk about their prenatal care, make sure they're getting prenatal care, discuss those barriers to prenatal care, including things like depression, financial barriers, things like that. So you and the word coddle is not bad in this aspect. So you coddle them through the pregnancy, and you're not just every 4 weeks seeing the doctor and you don't see anybody else. Black women have a 3 to 4 times morbidity and mortality risk, right?
And you know what? And a lot of Black women don't know that. They don't know the risk.
I mean, I didn't get pregnant till I was 37 because I was afraid of numerous things. I know everything that's going down.
Right.
So not only was I concerned that I would have a child with autism or some other psychological diagnosis because it is in my family. I was also concerned that what if I needed to have surgery? What if I did die on the table? Right. Or during delivery? What are all these different things? And I'm an educated woman that does this for a living. So it took me time to understand that, okay, I can do this. If the Lord wants me to be alive and with a child, then I will survive.
Exactly.
But I also did everything I possibly could up to that point. So clean eating. So Kelly Elmore took out the meat, took out the extra carbs, stopped drinking all alcohol for 2 years. I didn't know I was preparing to get pregnant, honestly. But when something clicked in my mind and said, it's time, then my mind was prepared, my body was prepared. The funny thing is, I had to go, when I got pregnant, I went overseas for a year. I was by myself overseas, so I had no clue that when I left that I was pregnant. Right? The OBGYN didn't know. Soon there found out, so I got my prenatal care started early. But then it was my wonderful friend who's a nurse practitioner that became, and my colleagues at work, that became my support network. Right? And so that's why I lived on an island and could have a wonderful, stressless pregnancy, even though I was away from everybody I knew. And then I came home and had my son here.
Okay.
Completely natural. I was like, I met women in the island I was on.
Yeah.
They had natural births.
Yeah.
They figured it out. Big babies, little babies, whatever the case was. And I said, I'm going to do that.
Absolutely.
And then that's what we did. And Mr. Francis is
all natural.
all natural, all natural. Except for he don't sit down, but that's because his mama don't sit down.
got that natural.
Honest. He inherited that honest.
But so many of our women don't have anybody to talk to. It's not about socioeconomic status. It's about the fact that we internalize our stress. Oh, I'm good. How you doing? I'm good. I'm good. No, you're not good. And you need to let somebody know that.
Absolutely.
So I have patients right now that they can communicate with me even when I go overseas. And they said, you know, Dr. Elmore, I'm concerned about this. Oh, well, let me contact such and such. Let's talk about it.
Yeah.
They know they have a network.
Good.
So
Good.
That is awesome. I would like to dive into the cervical cancer screening.
Yes. Okay, so cervical cancer screening. So this has changed over the years.
Yeah.
It used to be as soon as you became sexually active, then you had to get a pap smear. So I really need to explain, just because you go to the emergency department and they did a pelvic exam, that is not a pap smear.
Right.
The first thing, they put a speculum into your vagina and they're testing for STDs. So gonorrhea, chlamydia, that's what they're testing for. Bacterial vaginosis yeast. But when a primary care provider or OBGYN says I'm doing a pap smear, that means we're putting a speculum in, we're taking cells with a little spatula and a brush off your cervix, putting it in a container, sending it to the pathologist. A computer is reading whether or not those cells are normal or abnormal. What we've come to find out, thank you to Henrietta Lacks and her cells. If you haven't read that book, please do, or see the movie.
Oh, we actually got to meet the family.
Wow, awesome. If those cells are abnormal, then we need to take a look at your cervix under a big microscope, take biopsies, little pinch biopsies, and send that off to the pathologist. If that's abnormal, then we need to do a procedure to shave your cervix, or if it's truly cancer, we probably need to take your cervix and uterus out, amongst other things. The problem is we get people that have their babies and don't get a pap smear for years afterwards. And unfortunately, I have had patients, not my personal patients, but people I know of that have had a pap in a year and a year later unfortunately have cervical cancer.
Yeah.
So it's not the end all be all, but it's one of the best screening tools. The other thing is human papillomavirus causes cervical dysplasia and cervical cancer. There's hundreds of these viruses. Every time you have sex, you have the opportunity of contracting this virus.
Right.
So there's a vaccination out for it. It's recommended now for people aged 9 to 45.
Oh, they changed it?
They changed it?
Yes. The reason why is because you can be with one partner, but we know the divorce rate in the States and other places is 45-50%, right? So you have a new partner. Well, guess what you got? A new opportunity to get HPV.
Yeah.
So we need to vaccinate our women and men
I was going to say
from
right.
the risk of high-risk cervical cancer. So pap smears based on your age. So starting at age 21, we start doing pap smears on women. Between 21 and 29, we're doing them every 3 years if they're normal. Over the age of 30 and over, you get a pap smear and an HPV viral test. Both of those are negative. You get every 5 years for your pap smear HPV test. And then at age 65, if everything's been normal, you can stop doing pap smears. Some women don't want to do that, and that's okay.
Every year they still want to pap every year.
I have a question. Why did they change that to, because my last pap was 5 years ago, which obviously you don't get another one until 5. I'm like, why?
So the research has changed, right? So now we know. So the thing is, when PAPs came along, before they came along, people were dying of cervical cancer. So then we started papping people. That decreased the morbidity and mortality rate.
Okay.
Well, now we know HPV is the cause of that. So if you don't have the HPV, then most likely you are not going to progress to cancer. Like less than 2% of people will actually progress to cancer if they don't have HPV. So that's why they've extended that, time period to 3 to 5 years.
Well, I told sis that, she's like, I said, well, I want mine every year. She said, you go ahead and get yours.
Some people don't, they just refuse to, so I'm like, fine, whatever. But, you can't talk them down.
Yeah, you can't, and that's okay because we've ingrained in them
Every year.
Right.
But the other thing is, now if a woman says, I want something every year, that's fine. Whether or not your insurance is going to pay for it, that's
story.
where it is.
Right.
So if you say I want something, You can get it done. You just got to pay for it.
Right.
It's just like my construction person said on my house. Oh, you want that? You got the money. We can handle it.
Yeah, you can have whatever you want.
I know people are like, oh, that's unfair. It's my health care and everything like that. But remember, we have to provide health care for millions of people. And so if we find ways to say we may not need to do this screening as frequently, then okay. But if we need to do something, we can always work something out.
And usually the women, I mean, the most reasonable ones are going to listen to you as long as you explain it to them well. That now studies have shown that, you know, you're at less risk, so you don't need this. And some of them are like, oh, thank God, because I didn't like it every year. But some are just like, no, I'm anxious about it. So sometimes they just want a pelvic exam.
Exactly.
And they don't realize that a pelvic exam and a pap smear are not the same thing. And it's all about explaining it to them.
Yeah.
And so, yes, we really need to educate them. And once they, oh, okay, then they're okay with just getting a pelvic exam. We can just make sure their ovaries and uterus feel fine, normal size, that sort of thing, and then they're good. So the other thing is I know we were immunizing the young boys and girls, and so in family medicine, I was immunizing all my young kids and teens, preteens, but I did not realize, when did it change to 45?
It's just been in the last couple of, I just got it in the last couple of weeks.
Okay.
Okay.
Am I
New information on our radio show.
Breaking news.
I know, because the last time we had touched, it was not 45. So
And everybody hasn't caught up, so all the insurance may not have caught up. So you pull out CDC, FDA. This is what it says. This is what I want.
Absolutely.
So you may have to call your insurance company and all that other stuff. But I think that, you know, if you believe in vaccinations, which I do, then anything that can decrease your risk of progressing to a cancer. If I told people today they had a breast cancer vaccine,
oh, I'm getting it.
But some women wouldn't, because there are some people that are really against vaccines.
and that's fine. And I work with them, and I say, okay, well, let's figure out another way. That just means I'm going to screen you more.
Absolutely.
So I'm okay with that.
Absolutely.
I have a question. Why do so many African American women have uterine fibroids? I mean, it seems like every time you turn around, fibroids is like our life.
And it does run through families.
It does.
Yeah, okay, so it is hereditary?
It's genetic,
Genetics, okay.
right? It's what we eat. It's what we put in our bodies. It's what we put in our hair. We do have research out now that says relaxers and all that other stuff can affect our bodies and our cells. It's 60 to 80% of women actually have it. 60 to 80% of women. Okay. So, but we know a lot more brown women than we do everybody else, right? So it seems like we all have it. But to be honest, when I do work around the world, most of my women of color have fibroids.
Okay.
Now, do women that don't have, not women of color, get so big? Not necessarily. That's the question of, are you going to the doctor? Are they doing your exam? So that bimanual pelvic exam is important, even though you'll see some literature that says, unless they're having pain, you don't need to touch them. I will tell you, ask your doctor for a head to toe physical every year to 2 years, right? Because if I do your bimanual exam and I don't feel anything, and the next year it feels bigger to me, let's get you an ultrasound.
Absolutely.
Let's see what's going on. So now something's there.
Ultrasound.
Yeah, now something's there. Okay, do you want to do something about it now? We don't necessarily have to.
Right.
But if it starts affecting you where you're having irregular bleeding, you can't, you're urinating or urinating on yourself all the time, your belly is big, you're doing everything, eating right, exercising, you used to have this big belly, then guess what?
Or you're bleeding like a pig.
Or you bleeding, coming into the emergency room getting blood transfusions, and guess what? We need to do something
Right,
about it.
absolutely. Absolutely. No, I know it is hereditary. It does run through families genetically. My mother had a hysterectomy at 50 for humongous fibroids. My sister had one at 50, and I had one at 50. And my fibroid was probably the size of a grapefruit that I've been dealing with. And the only reason why I went in was because I was so anemic, meaning I was short of breath. My blood count had gone down to like 6 point something. So I had been accommodating, right? Because you're busy working and you're chief and all this stuff. And so, you're doing all that. And it's like, why am I short of breath going up some stairs? Why can't I play tennis for 2 hours anymore? Why am I huffing and puffing? I go get some blood work, and it's like, man, I know I'm bleeding, but I didn't realize I was bleeding out. And so, I had to go ahead and get a hysterectomy too. It's like, okay, fine, whatever. And I knew it was probably coming, and I knew I had fibroids, but I didn't realize how much blood I had lost until I was like, truly, I did not realize my count was so low. Because you can accommodate as you slowly bleed off each month.
Right.
So we had it last July. We actually had a nice symposium that was organized by one of my sorors, Sora Edwards, with the San Diego Delta chapter. And then Dr. Akila Weber, who just, by the way, became a member of her city council in La Mesa. So yes, and she's an OBGYN, actually a pediatric gynecologist, adolescent gynecologist, and then a psychiatrist, a dietitian, and everything like that. So July in the state of California is now Uterine Fibroid Awareness.
Oh, fabulous.
Okay, so July, I have to make sure that.
So, definite options that don't require major surgery. So knowing sooner rather than later, like anything, typically helps us do more minimally invasive things.
And we've come so far now. I mean, back in the day, we weren't doing a lot of myomectomies, you know, especially on young people that still wanted to have, you know, children. So now we can do the myomectomies, remove the fibroids, and still keep the uterus intact so that women can still, you know, of childbearing age, can still have children. So there's so many things that have come. We have, oh my goodness, and I see you, I put down here if we had time, but we don't have a lot of time for anything. We probably have time for one important thing that you may want to talk to the audience about, because the time has just flown
I
by.
actually would like to say, for our audience, how would you what advice would you give them if they would want to be a OBGYN doctor on helping women?
Okay. So what advice I would give is, number one, you can do it.
Okay.
Number two, reach out and seek a medical professional. So if the only person you are in touch with is your nurse practitioner, start with your nurse practitioner. Start with your primary care doctor. Only doctor I knew was my pediatrician. That was it the whole time I was growing up. So guess where I started? There.
Okay.
My high school principal. So you can do it. The other thing is, be comfortable with your provider. Because if you're not comfortable with your provider, you're not going to follow the recommendations. You're not going to believe them. So find somebody that you're comfortable with. And the way you find that is, yes, you can go through your insurance company, but ask your friends, right? And utilize that person.
Absolutely.
We have virtual healthcare. We have electronic health records now. Get involved in the virtual healthcare pathway.
Yes.
Because that's a way you can communicate with your provider team. And if your hospital or the person doesn't have it, then guess what? You need to eventually ask them to get it or move on. Because that's the direction we're going in. And then finally, I would just say, please get your screenings done. Like I said, head to toe physical exam every 1 to 2 years. If it's time for your pap smear, get it done. Breast exams, mammograms, get them done. Colonoscopies, get them done. Prostate, get them done, especially in people of color. Because you guys know, everything that has our name attached to it seems to have higher risk, higher mortality, and higher morbidity. And it's not because we're black. It's because we find out typically later. Now, some diseases, yes, we have a higher risk associated with those. So.
That's awesome. That is awesome. Yeah.
Well, for our announcements, actually, I don't have event of the week.
You don't have a vent? You're not willing to vent this week?
No.
Well, we can just speak about how successful the event was yesterday. So we had our final 2018 community outreach event, which was yesterday, December 5th. And the one thing about it that I thought was awesome, that we were able to collaborate with San Diego's Continuing Education over at ECC and join on to their grand opening of their fair. You know, basically, it's food to family, and it's a fresh produce distribution thing that Feeding San Diego participates in. But the ECC was able to bring like another 30 or so vendors, and then our community event brought our 25 vendors. So it was a really good event, and we had dignitaries there that spoke to really support this event. So moving forward, we are going to plan on joining them on their campus every month.
We haven't decided yet.
Yes, we did. Yes, we did.
We haven't decided yet.
I already had a conversation. Unless you plan on doing big lots.
No.
So we're moving forward with advancing healthcare in the community.
Somewhere. We're planning on still doing it. So that's
collaborative effort.
Absolutely. So, it was good. We had a great turnout despite the rain and everything. So, we're just going to continue to do that. And so, with that, sis, we do need to wrap it up.
Yes, we do. And want to say thank you, Dr. Kelly O, for being here and taking time out to share your story and your educational experience. You've been listening to the Many Shades of Pink and Black Health radio program on KBOK Radio. I'm your host, Wendy Sherrill, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Fallo, retired family physician. And we want to say thank you to our special guest, Dr. Kelly O, MD, board certified OBGYN physician. And it's been an awesome experience. We're going to have you come back because there's so much we didn't get a chance to touch on. But at least we got just a snippet of who you are, what you're doing in the community for our women, and we want to say thank you for that.
Be sure to tune in every Sunday at 2 p.m. on KBOKradio.com and visit and like our Facebook and subscribe to our YouTube channel, Many Shades of Pink and Black Health. And for more information on breast cancer, visit the Coleman San Diego Circle of Promise, and that is www.colemansandiego.org.
And you can learn more about A Healthier Me, which is a lifestyle change program, at www.ahealthiermesd.com. So thank you.
Thank you.
Bye-bye.